Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Pediatric Assessment, Episode 4, Assessing the Teenager. After viewing this episode, participants will review the physical and developmental characteristics of a teenager. Participants will review the barriers that influence the assessment of a teenager and how to reduce them. Finally, participants will review normal and abnormal physical findings, vital signs, and weights of a teenager.
Teenagers are the most, I think, challenging of the groups because they are going through a transition period where they're not yet adults, and when they're sick or times when there's an accident or an emergency, they revert to being toddlers. They revert to being needy and they revert to wanting their caretaker around. So this is the most challenging of it. As far as assessments, vital signs, all of that stuff, that would be within adult ranges. So you're going to assess them just as you would an adult head-to-toe assessment, airway, breathing, circulation, and making sure that you address all of those as you would an adult.
Teenagers can be very difficult to interact with because they're really at a point in their life where they're struggling for autonomy. They want to be out on their own. You could very well encounter a teenager who's by themselves. Perhaps they were the driver in a car accident or they are seeking health care on their own. They can often become very defensive very easily because they're worried about getting in trouble or perhaps losing privileges at home based on a scenario. They also can be very concerned because perhaps they were in fact doing something wrong, perhaps alcohol or other things were involved, hence prompting the need for EMS. It's important to remind the teenager that you're acting as their medical provider. Things can be confidential to a certain standpoint, but of course their safety is the most important thing. And you're there to provide help for them, but you're there to make sure that they're safe as well. The major differences of teenagers compared to other groups is they really are physiologically like adults for the most part, as long as they've gone completely through puberty. It's very common to have a fully developed teenager at 13, 14, 15 years of age, and they should, from an anatomic standpoint, be treated like an adult. However, we do see something called sinus arrhythmia in teenagers. This is the young, healthy, athletic type of child who will very commonly have a resting heart rate in the 40s to 50s, and that can be perfectly normal for them. Again, as long as they're not symptomatic with that, I would not be concerned. Another thing we often see is respirophasic changes, meaning as they take a breath in and out, their heart rate will vary in its regularity. This is not concerning at all. What you can do is ask the teenager just to hold their breath while you take a listen, and that should cause the rate changes to go away. So normal sinus rhythm, but with this variability, can be totally appropriate in the teenage years. Low resting heart rate can be totally appropriate in the teenage years. Normal vital signs and weights for teenagers should be that similar to the adult. As I mentioned though, there is this phenomenon of the sinus arrhythmia where a teenager will have an irregular heart rate, but the rhythm itself is sinus, and that's perfectly appropriate. They can have a low resting heart rate as well and be perfectly appropriate. And tachycardia would certainly be a heart rate above 100. Respiratory rates should be in the low teens, similar to an adult. Blood pressures do at times tend to run a little bit lower. It would not be unusual to have a thin teenage girl or a smaller teenage male have a blood pressure of 90s over 60s or 90s over 70s. And again, as long as they're maintaining appropriately, perfusing appropriately, that's totally appropriate for that teenager. They have a good vascular tone and usually can tolerate much lower blood pressures than a person of similar size that perhaps is 70 or 80 years old.
Teenagers are anatomically and physiologically similar to adults. Sinus arrhythmias and respirophasic changes can be common. Teenagers presenting asymptomatically with these changes are not concerning. Vital signs and weights will be similar to adults. Teenagers will strive for autonomy and may become defensive. Teenagers are often encountered away from their parents.
Assessing a teenager should be done similar to assessing an adult. Of course, they should be able to communicate with you clearly, follow your commands, and participate fully in the exam. So, of course, letting them know what you're going to do. Should you need to look at any of the private areas of their body, that could certainly be very awkward for someone in the teenage years, and you'd want to have a discussion with them before doing that. Certainly would want to be no surprises to the exam, but explaining what you need to do and the rationale behind why you need to do. Teenagers certainly like to understand why something is happening to them. So a thorough discussion, but yet a quick and a medically appropriate discussion is going to be enough to get the teenager hopefully on your side.
Remember, peer pressure is most of the time going to win. So if they were in a group of students or they're a group of kids and this is what happened, they're going to protect their friends, they're going to protect everybody else, they're not really going to get truthful with you. As well as you have to remove parents, because parents have one opinion of what their child should be acting like or is acting like, and they may be having completely different saga going on within them. So you have to kind of elicit that information and not violate the trust that you're going to have with a teenager.
Knowing how to talk to a teenager is important. They may not give you the information correctly, or they may not give you all the information because they don't want to tell you everything because they may get in trouble. Teenagers, like I said, they definitely need their privacy, and it depends on what type of examination you're doing. Adults have already, probably been to a doctor, where the teenager may have never seen a doctor. It could be their first time in the emergency department. So explaining your care to them, explaining what you're doing, giving them the privacy, listening to them, because teenagers do want to be heard. I feel like sometimes teenagers don't think that their parents listen. So it's important for us to listen and take in all the information, but also listen to the parents. And you may have to separate the child from the parent to get your information, depending on what the teenager is presenting with.
Teenagers will be able to communicate, participate, and understand the situation. EMS should protect their privacy and respect their modesty. Teenagers will have a tendency to succumb to peer pressure and will likely protect themselves or friends. Parents can become a barrier in assessing the teenager, however, still play a vital role in the treatment and assessment of the teenager.
So common barriers with assessing teenagers are a couple of really more interactive or behavioral stuff, meaning they tend to be dramatic, they tend to be where this emergency that they're in is the worst thing that could ever happen, as well as they may be going through a time where they're not always truth tellers. So especially if their parents are around. So this is some of those things that you might have to overcome as obstacles when assessing teenagers.
One of the most challenging assessments of a teenager is a teenager who unfortunately tries drugs and alcohol. And these teenagers, usually, good kids, they just decide to try something and they come in. It is so difficult for EMS and hospital personnel to care for these teenagers. I had a case where a teenager, by lunchtime, completely intoxicated. So you have police involved, you have EMS involved, and you're trying to contain a child because now the parents may not know that their child's in the emergency department, they're intoxicated, and now they're trying to escape. And they have no idea what you're telling them because they're incompetent, they're intoxicated. So you're trying to take care of them, but also keep them safe and trying to contact the family. So that is probably one of the most challenging and difficult cases to take care of, because those teenagers, of course, they could easily die because they're so intoxicated. They could aspirate, and then you have to try to find out, have they taken anything else? So for me, I find them to be the most challenging. And for a nurse, it's great when EMS can provide us with where they were found, how they found them, any alcohol around them, any bottles of pills, just kind of the whole social situation, because it helps us put the whole story together.
We had a young gentleman who was hit by a car, and the challenging part was his appearance, his interactiveness was not adding up to the story that he was telling me. His vital signs were all fine, and injuries was he had a right broken tib fib, so that was fine, but his affect was not adding up to the story that he was telling me. And of course, I took his mom aside, and she was telling me that he was going through some behavioral stuff, and there was some drug use previously, but she swore that he had been clean and that he was in stuff. And really, it took for me to get her away from him and to really call them on the carpet and say, look, this is what I'm seeing and this is what I think is going on, and I really need you to be truthful because that's going to impact how we move forward, especially when you have something like a broken leg that they might have to do some surgical intervention with.
Situations involving drugs, alcohol, and other social issues prove to be difficult. Stick to the exam findings and investigate thoroughly the possible mechanisms causing abnormal physical findings. Removing the teenager from the situation and external influences may help identify the root cause. After viewing this episode, participants will review the physical and developmental characteristics of a teenager. Participants will review the barriers that influence the assessment of a teenager and how to reduce them. Finally, participants will review normal and abnormal physical findings, vital signs, and weights of a teenager.